I just being able to connect with somebody about what's really important to them and to add some value to their own health sovereignty, to their health span, to their lifespan. Like it's so rewarding that yeah, it is, telemedicine didn't exist when I was in. I mean, Zoom didn't exist when I was in med school. The idea that you could have a video call on your phone didn't exist when I was in med school. So like none of this could have been predicted back then. But the path that I have followed is like what speaks to me. My life story professionally, Grant, is that what we're looking for? I'm going to try and breeze through it, but it has been a really circuitous, your comment early on around paths being sort of winding and often not straightforward. I think that resonated tremendously well with me. So I grew up in the Northeast in New Jersey. I got yanked out of and I say yanked out because that was really my perspective at the time, out of the public school system in my township into a private school, very much like OES. Fully day school, didn't have a boarding component, but similar sort of environment. And because my mother started substitute teaching there and then got a full-time job as an English teacher, and at the time you got to go for free if your parents taught there. So they said, "That's it, you're coming," and it was an amazing education. After I got used to the dress code, I was pretty much on board being a student there. Um, Gravitated to music and science were really my passions when I was younger. I have some very embarrassing photos that thankfully the internet wasn't around back then of me with like super long hair playing in a thrash metal band and all that kind of stuff in high school, getting into a lot of trouble. And I went to college at Brown University. I majored in music and evolutionary biology. Had a very strange summer gig there where for a couple of years I worked with primates at the Roger Williams Zoo, basically observing social behavior and like stealthily petting them, which you weren't supposed to do, but they were adorable. So that was sort of my love of biology. And I thought for sure I was going to be a biologist. I was going to either do marine biology or primate biology. And sort of towards the end of undergrad, I thought, you know what? I might actually just want to do medicine, but it was way too late for me to apply straight into med school. And I ended up spending some of my senior year of undergrad doing all the things that nobody wants to do as a senior. So, like organic chemistry, physics at the college level, and all that kind of stuff. And I took the MCATs at the end of my senior year of undergrad, which was too late to apply for that cycle of medical school. So at the time, I was renting a warehouse that I was living in from one of the modern culture and media, or like sociology film professors downtown. And he said, "Hey, do you need a job next year?" I said, "Yeah, I think I totally need a job because I don't know what I'm doing with my life." And he said, "Do you know how to work with computers?" And I said, "Yeah, I mean, kind of." It's like, "Do you know how to like take the casing off of a computer and like replace boards and like fiddle with the inside and configure things?" And I was like, "Absolutely not, I don't know how to do that at all." And he was like, "All right, well, come for an interview anyway, and then when the guy who runs the program asks you if you can do something, just nod and say yes, and we'll just teach you on the job." So that was my first job out of college. Was I worked for what was called the Scholarly Technology Group at Brown. They were setting up a multimedia lab, and just to date myself, there were 15 computers. A few of them would do graphics, a few of them would do audio processing, and two of them did video processing. It was too much load on the computers at the time to be able to have all of the software on one computer. And for like video, you'd like set up to render a 2-minute video and you'd go home for the night and lock the lab up. And in the morning, you just go in with your fingers crossed that it hadn't crashed and that it had actually done your 2-minute video. So we've obviously come a long way with technology, but that was my job for a year. Applied to med schools. Applied to probably 20 medical schools. I think I got interviews at five and I got into three. And I was super stoked. I went to med school in New York at NYU. At the time, it was right now it's the number one or number two med school in the country. At the time, it was like the 25th or 30th med school in the country. Like I never would have gotten into it today, but I got in back then. Um, and went through med school, and I guess sort of like third or fourth year of med school, it kind of clicked for me that I liked everything. I liked diagnosing things early and being involved in the diagnostic process. I really enjoyed that part of medicine. And I didn't really want to hone in on a really tight subspecialty and sort of just do the eye or just do the brain or just do the heart, et cetera. So I made the decision I was going to go into emergency medicine, and I was going to get to see old people, young people, men, women, all sorts of trauma conditions, surgical conditions, medical conditions, everything. Um, went into emergency medicine. I went and that was my introduction to the West Coast. I decided if I wasn't leaving New York, then I was never going to leave the East Coast, and I matched into a residency program in California. It was sort of a split program between San Francisco and Oakland, and worked there, trained in emergency medicine, and then went into basically like 10 years of academic emergency medicine from there. So working in large, um, sort of, OHSU type healthcare systems in San Francisco, in New York, in Boston. Um, Started a couple of businesses while I was doing that, on the side, just as an interest. And then ultimately, I got to this point 2016 or so, maybe 10 years into practice, where I didn't want to do the particular thing I was doing for the rest of my career. I didn't really want to become a chairman in emergency medicine, although that was an option. I just felt like I'm not really much of an administrator, and I've always kind of struggled with authority, and I didn't want to be the authority. And one of my friends from training in Oakland had been working at Legacy Emmanuel since training and said, "Hey, are you guys still looking to move to the West Coast? One of our partners is retiring. Do you want to come out and look at a job?" And so in 2016, my wife and kids and I moved from Boston to Portland. And I started working at Emmanuel, and I worked there for 5 years in the emergency department, all the way through the first year and a half of COVID, which was definitely a challenging time to be in the emergency department. Um, Even prior to COVID, though, something else had bubbled up for me, which was I was very disillusioned with, let me say as a caveat, emergency medicine is a really important field. It's probably the glue that's holding together the traditional healthcare system in the United States. If you get sick and you have no way to pay for something and you go to an ER, you're still going to get cared for, and you'll just get a bill that you'll never pay. And it's really the safety net for modern medicine in the United States. So I love it. I don't regret working as an emergency physician at all. That said, I felt like we were really putting late fixes onto problems that had developed and been present for years, and that we were really ill equipped to keep people well. I mean, you look back at traditional Chinese medicine, and in TCM, you paid your doctor when you were well. In Ayurvedic medicine, you pay your doctor when you're well. In the United States, you pay your doctor when you're sick. And it's just a completely flipped paradigm of, is wellness more important, or is it more important to just live your life and do whatever you want, and then when you get sick go see the doctor? And at the same time that I was sort of dealing with this internal crisis, is probably too strong of a word, but struggle, two of my friends from the emergency medicine world had started a new business where their goal was really to take the best parts of Western medicine and the best parts of sort of ancient wisdom, reconnection with nature, uh, non-traditional healing techniques, and to put it all together into one business that was to where the goal was really to help people optimize their health. And they started this business. I was still working in the ER, and they reached out and said, "Hey, we're actually growing really quickly, faster than we thought. We can't see all of our patients because we have too much demand. Do you want to start seeing some patients with our company?" And it's basically precision medicine. You're personalizing medicine for individual patient based on their goals, their genetics, their lab results, their weight, their heart rate variability, like all these biometric things. It seemed very cutting edge and cool, but also very nature based and non traditional Western medicine. And I said, yeah, sure. I don't know anything about that and how to do it. I've never been trained in it, but why not? I'll try and learn on the job because going all the way back to my job after college, that's what I did. Is I said, yeah, I know how to do this when I didn't, and I just figured it out along the way. Um, and fast forward a few years, and I work full time for this business. We have about 3,500 patients around the country. It's all done via telemedicine. So it's all, I spend all day on Zoom. So this is very familiar for me. And I get to spend an hour at a time with an individual patient, which, just for contrast, in the emergency department, I probably spent about 90 seconds with a patient before I was on my way to order something else or do something else for another patient. And in a typical ER shift, I would see between 30 and 40 patients in 8 hours. And in a typical day at Wild Health, which is the business where I'm working, I probably see 5 patients, and dive really deeply into what's going on with them. And I know everything about them, from what's important to them, their family structures, their family histories, their genetics, their labs, their goals, where they're struggling, what they're eating, what their training looks like, how they're recovering, how they're sleeping. And I'm getting to see, over the last couple of years of working with Wild Health, these tremendous shifts in people's lives, where they come to us sort of just not great. They're not super sick. Some of them have associated illnesses that we help with as well, but some of them are just a little bit overweight or a little bit sluggish or really stressed out or just not really getting the most out of their lives. And it's pretty amazing. I kind of feel like a family doctor, although in a small town where I know everybody really well and I know what's important to them, but it's all via telemedicine. So that's been an amazing transition and enough to inspire me. I'm actually opening a brick and mortar practice in Portland, doing integrative medicine and precision medicine. And my area that I've become particularly focused in is in mental health and healing from trauma and chronic stress. And so, to your point, Shannon, this is sort of where I was like, oh my God, we have to connect. Um, so I'm opening a business doing integrative healthcare and health optimization, but also doing ketamine infusion therapy for patients with post-traumatic stress disorder, anxiety, OCD, depression. Because working in the emergency department and seeing the growing crisis of mental health ailments that's happening in our country, that's only getting worse after COVID, it just seems like I have a lot more value to add in that field, and it's really rewarding watching people get better from trauma they've carried their entire lives, as opposed to just fixing a broken bone. Which is, again, if I break a bone, I'm going to go to the emergency department or an urgent care. That's where you want to have that taken care of. They do an excellent job, but they don't do an excellent job keeping you well. So that's sort of me in a nutshell, as short as I could make it. Sorry, I get a little rambly, but really passionate about what I do, and happy to answer any questions or expand on anything I mentioned. Yes, Gabor Mate, absolutely familiar with Gabor Mate.
Well, that was fascinating. Thank you. I appreciate it. I have a few questions. I'm wondering how because obviously it's vastly different, the ER to telemedicine. What kind of were the biggest changes in your opinion in terms of the care and what you're able to do? Then I'm also wondering, do you have like outcome studies about this type of medicine as well?
Great questions. You guys are asking great questions, both to Shannon and already to me. Changes in care. Well, I'll say, like, just lifestyle changes, switching from the emergency department to telemedicine. I kind of got to reclaim a little bit of sovereignty over my own health. I worked overnights, weekends, evenings for almost 20 years, and being able to I've got a ninth grader and a sixth grader at OES. Being able to be around for all the the golf tournaments and the tennis tournaments and the back and forth to school activities has been pretty amazing. And just getting to reclaim my circadian rhythm and my sleep schedule has been amazing. I'm lifting heavier weights than I have my entire life. I'm sleeping more hours than I have my entire life. I'm in like the best shape of my life. I'm almost 50. So it's been a really amazing personal experience. In terms of changes in care for patients, I had plenty of times in the emergency department where I had moments that I know I either straight up saved somebody's life or made a really positive impact or really helped alleviate pain when someone was suffering or brought a lot of value. It's hard to compare it kind of side to side, but I think that we have a measurable impact on all of the patients that we treat at Wild Health. In terms of outcomes, um, I should have these like on the top of my head, but I can tell you just as one. So number one, I'm not advertising to you guys, but certainly, and we don't treat anybody under 18 yet, so no conflict of interest. But you can go to wildhealth.com. You can check out what we do. Some of the outcomes are there and are more. And I'll just put the thing in the link in the chat while I'm talking. Some of the outcomes are there, but we did an analysis of about 1,000 patients that we treated over the course of a year. And we reversed prediabetes or diabetes in 50% plus of those patients without using any medication. So we're not averse to using medication. If somebody comes to me and their cholesterol levels are really high, we have about 5 to 10 things that we work on with folks before we consider putting them on a lipid lowering prescription medication. And that's successful in a lot of people. But there are definitely people who benefit from prescription medication, and that's really the needle that we've thread and that we continue to thread is um, we're working on everything you can do lifestyle first. If you also need some medication because you have, genetically, you're just going to have high cholesterol. It doesn't matter how well you eat, how much fiber you eat, how much you exercise, how you time your meals. No matter what, you can do all of that and still have an increased risk for cardiovascular disease. You're going to benefit from being on a lipid lowering agent. So we'll use traditional medicine when necessary, but it's always sort of a second line agent for us as opposed to you go to your doctor and they check your labs and this is high, so here's a medicine. And that's the sort of medicine that we really have worked to get away from. Valerie, do you use weight loss meds in addition to intensive lifestyle therapy? There are times where we think about so in weight loss meds. I think what you're getting at is sort of the GLP agonist. So things like semaglutide or Wegovy or Ozempic, the brand names, and you see these floating around in Hollywood and elsewhere, to the point where diabetic patients are having a hard time finding these medicines because everyone else is using them for weight loss. There are patients in whom I've prescribed semaglutide. They're typically diabetic, significantly overweight or obese, and it's used as a bridge. We use it as a bridge to get them to kickstart some weight loss, continue their weight loss with lifestyle management, and then taper them off. So certainly there are times where that's appropriate, but really somebody's got to have a strong indication for it, and not just I have a wedding coming up in 2 months and I want to drop 5 pounds so I can look good for the wedding. Yeah, I'm not going to prescribe semaglutide for that, but plenty of people are prescribing it for that. Um, do I miss something by not touching a patient and examining a person? Um, there's two ways I can read that question. So, like personally, as a physician, is there something less satisfying about telemedicine, or do we miss things that are clinically relevant by not examining a patient? So, the first one, yeah, a little bit. That's why I'm opening a practice in Portland. Is I really do like getting one-on-one time with patients in person. And the second one, you know, it's overrated, the physical exam for screening for chronic medical conditions. It is not overrated for manipulation, for body work, for acupuncture. There's plenty of times where it's really important to see someone in person. um, I will often, many of my patients have their own primary care physicians or other healthcare providers locally, but they're not getting a really deep lifestyle and integrative approach to their health through that provider. So in those cases, we recommend they continue to see them. They get their annual physical exams. If they have something troubling them, they go in and see them. But we really end up kind of being the quarterback for their care. And then when they need something in person, that's done in person. So that's a great question.
I have a question about the online aspect. So prior to COVID, were you already doing like online meetings, or was that something that originally happened because of COVID and you just continued to do it?
Yeah, it's a great question. So COVID completely changed the scope of telemedicine. In the first month after, in April of 2020, there were more telemedicine visits than there had been combined in all time prior to April 2020. So yes, it was sort of like here telemedicine's kind of creeping up, and then it just went to an entire new level at that point. We did have a brick and mortar in Lexington, Kentucky, which is where the home base was for the company and still is. Um, I was still seeing people via telemedicine. It was not as busy via telemedicine. We had patients who were carrying. I was taking care of some uh, people from mostly the West Coast at that point, and then as the need grew and the demand grew, I think I have 26 or 28 state licenses at this point because you actually need to be licensed in the state where your patient is, and not just licensed in your own state. But yes, telemedicine has kind of unlocked a huge opportunity, and you know, not just from a business opportunity, but from a patient standpoint, it's really a lot more convenient to hop on a call with your doctor than it is to drive to the doctor's office and wait for an hour because they're behind and then have to, get your parking validated and head back home. So once that flipped and regulations were loosened around telemedicine, it was very clear it's never going to go back to the way it was. People definitely still benefit from going to someone in person, particularly if there's an intervention happening, and that can be as simple as working with a physical therapist, or as specialized as what Shannon does, and seeing an acupuncturist and getting body work done. It can be having a procedure performed. There's all sorts of reasons why you want to see someone in person, but I would say back of the napkin, 80% of your care could at least start in a telemedicine setting, and then you may require some in-person care on top of that.
Sweet, thank you. And I have one last question. So you kind of talked, about your journey and that was somewhat unexpected, I think. Was it kind of difficult for you because you took a lot of, risks of, I'll just try that out. Was that, difficult for you and kind of, you're still doing somewhat related to biology, but not doing exactly what you thought you would be doing? Was that kind of difficult? And yeah.
Yeah, I mean, I think if I were to, it's no longer unsolicited advice because you asked that question. So now it's solicited advice. If I were to share some advice, it would be if something really speaks to you and inspires you, even if you're not really sure how it's going to turn into a career, you should probably go that way. To hear Shannon 20 years, I don't remember exactly what you said, 15, 20 years into practice, loving what she does and being able to actually go to work and just really love what you do. Work can either be something you do to pay the bills, or it could be something that you love doing that pays the bills, or it could be some variation of those things, right? For me, I get on a call with a patient, and even with it, if it's my fifth call of the day, I'm a little tired. I haven't had a chance to go out for a walk or do something good for myself that day. I just being able to connect with somebody about what's really important to them and to add some value to their own health sovereignty, to their health span, to their lifespan. Like it's so rewarding that yeah, it is, telemedicine didn't exist when I was in. I mean, Zoom didn't exist when I was in med school. The idea that you could have a video call on your phone didn't exist when I was in med school. So like none of this could have been predicted back then. But the path that I have followed is like what speaks to me and what's really interesting. And you know, fast forward 20 years, many of you guys may have families and responsibilities, and I'm certainly a little more cautious these days about radical career changes just because I have things like kids in school and a mortgage and bills to pay. But you don't have those for a while. And I think really just kind of following your heart and seeing what speaks to you. Yeah, I couldn't have predicted that my career would go this way. I don't know what it's going to look like in 5 or 10 more years, and clearly I'm like a little bit more risk tolerant than the average individual. I mean, I was a freaking ER doc. You can't be an ER doc if you're not risk tolerant. You got to figure out what's wrong with somebody who you just met who's like trying to die in front of you, right? I mean, you got to be comfortable with the unknown. But I would say that just kind of pursuing the unknown and what really speaks to you has been what I've tried to follow along the way.
Perfect. Thank you.